Good afternoon, everyone. So happy to see you all here. Welcome to another NU and NIS Alumni Talks. Today we gathered as alumni, as a community we are proud of and actively building together. Every month we meet around a new topic. Last time it was technology, and today we are shifting to something more personal, which is health. So today's topic is health beyond medicine. We also have speakers who will be sharing their experience and expertise, and I truly hope each of us leaves today with something valuable, whether it's new knowledge, a new perspective, or even one small insight that stays with you. The main goal of these meetings is simple: to support and strengthen our community. And it's honestly amazing to see how you guys connect with each other, people from different cities, from different backgrounds, different industries, yet one shared network. So before we officially start, I want to warm up the room a little bit, okay? So we'll do some interactive activity, 3 quick steps, okay? So the first thing I will ask you is please stand up and give high five to the people on your left and right, please. Okay, the second thing is shake hands with the people in front of you and behind you. That's so smart. Nice. Have a seat, please. Thank you so much. And the last activity, third activity, is to, turn to the person sitting behind you. You'll have 4 minutes to learn something about them, like what's their name, what they do for life, maybe one interesting fact about them. And after that, I will randomly choose a few of you, and you will introduce the person you just met, okay? So let's start right now, 4 minutes. So, okay. As I said before, I hope you had enough time to learn about the person that's sitting behind you. And plus, we're going to have more time in the coffee break after all speakers, okay? Now, as I said, let me randomly choose, and I'll ask you to introduce the person that you just met. Please, you. Introduce her, yeah. Right.
Okay, so I actually met with some kind of chemistry teacher. Her name is Akhbota. She is at 34 years old, and she actually teaching the chemistry, organic and inorganic chemistry at KazNU, which actually be Kazakh National University is located, kind of will be here in Temirkhanov, and I know that she actually, in the beginning of her studies at chemistry, she actually hate chemistry, especially inorganic one, because she thought like in organic chemistry there was some kind of the logic how it's actually bond with each other, but in inorganic chemistry there was like a lot of exceptions, no kind of the logic. You have to know some kind of the rules or some kind of like patterns. That's all I know about the Akhbata.
What's your name?
Tamerlan.
Nice. Who recommended you to come, or are you the alumni?
No. Oh, my friend, my guest.
Oh, okay, nice. So, one more.
So I actually met 2 interesting persons. They are Nazarke and Aruzhan. They're both studying at the class of General Medicine and Asfendarov. They're both like 5th year. And Nazarke is from NIS Karaganda, and Aruzhan is from NIS Kostanay.
Okay, nice. Any interesting facts?
It was like CVO.
Yeah.
Also, Ayan and Nazirke and me from Kshizhis. It's an interesting fact. Yes.
Love it. And your name is?
Ayan.
Nice. You guys are alumni? Right. And you? Good. Perfect. And the last person is, please, you.
Okay. Hello, everyone. So this is, meet Aslan, an avid enjoyer of Korean and Georgian cuisine. He is actually one of our speakers today. He's one of our speakers today, and he is both NIS and Nazarbayev University alumni. He did his master's in Nazarbayev University on stem cells. He's really cool. He's also a family medicine doctor, and he works at Roche pharmaceutical company. And he enjoys volunteering, which I think is really nice and shows a lot of empathy on his behalf.
And your name?
My name is Inju Marjan.
Nice. Are you the alumni?
Yeah, I'm NIS alumni.
Good. Perfect. Thank you so much, guys. So let's start. Our first speaker, Yenlik Taurbek, NIS NIS Almaty alumni, class of 2018. She's a doctor of dental medicine. Little interesting facts about her. Her favorite movie is Big Hero 6 because it focuses on science, innovation, and the potential we all carry inside us. And one of the most meaningful things on her bucket list is to see the northern lights with her own eyes, to witness something powerful, natural, and unforgettable. Please welcome Yenlik Taurbek with her talk, Open Wide, Why Your Dentist Might Save Your Heart.
Thank you. Hi, my name is Yenlik. I think I was presented before, but I'm a dentist, if speaking simply. I graduated from the NIS back in 2018. It's here the physics and mathematics one. The other thing is that I studied in Hungary with a scholarship program called Stipendium Hungaricum. I'm sure a lot of you have heard about it. Okay, so basically focusing on the topic of my speech is why and how your dentist can save your heart. Basically, what I want to start with, we have a tooth. And the main thing is that, have you ever heard that before any huge operations or surgeries, any patient has to go through the dental checkup, like it's a must? If you heard about it, raise your hand. Well, okay, I see. So the main thing is that I'm going to start with that our mouth has its own oral microflora. It has a lot of bacteria, approximately from 50 billion to 100 billion, and more than 700 species, the different species. Here I only mentioned the Streptococcus mutans because that's the one that's causing the caries in our teeth. And as you see here, what I draw, the mouth, the bacteria, and it's actually why it's crucial to check our teeth, because before any surgery and during the surgery itself, our body, our organism is going to have the weakened immune system. It's due to the fact that, of course, the stress itself. The other thing is the antibiotics, the intravenous intake mostly. And the other factor is the previous anamnesis. So as you see here, it's important to check our teeth because the tooth, as well as its surrounding tissues, it is the active source of infection. And the dentist checkup is necessary before any type of surgery, especially if it's the heart, lung, liver, in case of any cancer surgery, and especially the very common surgery among the older population is the hip and knee joint replacement. So basically what I draw here, as you see here, is the plaque. For some reason, it's not seen very clearly, but I cannot do anything about it, sorry. The caries may go, the bacteria, this is the open space through which the bacteria goes inside the tooth. As you see here, there is the pulp. And we have a lot of lateral canals and the surrounding tissues as well. There are a few types how our bacteria may enter. The first one it's through the plaque. It usually accumulates when the person doesn't brush his or her teeth properly for quite a long time. And it may get calcified and become a calculus, which is very much harder to remove. And so the way how bacteria may enter is through the periodontal tissues or through the tooth itself. Basically, while entering the bloodstream, bacteria is going through the whole circulation to our heart. This is just one example how bacteria may enter. And here I put an example of the infective endocarditis. It's the disease where the bacteria resides on the injured heart valves. Here you can see the atrial and mitral valves. And the other thing is that the way how bacteria functions, the concept, is via the two ways. Either the organism is going to be stressed due to the bacteria itself or due to the immune response to that bacteria. What I'm talking about is actually, as you see here, that's the pre-concept that is important to learn about. Here we are focusing on our joints, basically the parts of our body that helps us to move. And the main thing is that, did I do it? Sorry. Okay, so the main thing, what happens in the joints, that why I mentioned it, our joints have, too early. Our joints have like the immune system and antibodies. And why I connected these pictures together is due to the mechanism of the rheumatic fever. What happens here? So basically, when patients come and they have a strep throat, usually it's after the pharyngitis or streptococcal tonsillitis that is quite common during the days. This infection, we have the bacteria here, it's called the strep throat. Our body, our immune system, fights these bacteria and produces certain antibodies against the streptococci. The name of these antibodies is the antistreptolizin antibody. It usually looks like the W because of the binding sites, but it's not important. The main thing is that immune system now has a certain memory against these bacteria. And what is actually crucial, that these pathogens, they have a similar structure with the structure of our myocardium. And our body, the immune memory, it confuses our body for the bacteria and basically attacks itself. That's called the autoimmune disease. It happens due to the mechanism of the cross-reaction. And these antibodies usually attack not only the heart layers, but also the articular joints, as I showed previously. Here, that's actually the etiology of the rheumatoid arthritis, how it usually happens, because it is also the autoimmune disease. And as you see, it has the same word inside. The another important part is that it also attacks the central nervous system that may result in different diseases, and the person feels not very well, if I put it shortly. So basically, our immune system can become an overprotective guardian, and it destroys everything that slightly reminds it of the pathogen. So here, why is it crucial? For example, that's the photo of my patient that I had, but the good thing is that patient is not undergoing through any serious operation or surgery. But the bad thing is she was only 19, and she had her teeth in a very horrible condition. As you see here, there's a lot of caries, the gums are inflamed, they were bleeding, and having teeth in that condition, even though if you are not feeling any pain, is very actually dangerous, since the bacteria is still going through your blood. You have the bacteremia going on. Your immune system is always alert for everything that happens. And the other part is that, for example, if you're going to undertake the major operations that the old people usually go through, for example, the transcatheter aortic valve replacement or any knee or hip replacement, that's crucial because imagine you're going to have this operation and these sites, they're going to be like magnets for the bacteria to reside in the future. The other thing is that the main problem is actually the mechanism how it all happens. The heart is one of the very susceptible places since it has the endothelium, and if the person, why like the anamnesis is very important. If the person had the previous history of, for example, fatigue or like diabetes or any metabolic disorders or like any sort of weakness or disease that may, even like the arterial pressure, I mean, it can all affect how our heart goes like and fights these bacteria and pathogens. Here, like that's the simple mechanism how the actually if our heart or our blood vessel, for example, has any rupture, there is a mechanism that's called the fixing of the endothelium injury. But the thing is, if you have the bacteria constantly in our bloodstream, this bacteria is going to reside on these NIS, it's called, like the thrombocyte aggregation place, and it starts to accumulate there. The mechanism is quite similar to atherosclerosis, where there is a plaque, and once it's going to grow and become very huge, it may just rupture and travel through the body, and one day the person might die. The good thing if he or she doesn't die, but I mean, it's still going to be like very dangerous. And the other thing is that is important in terms of the dental checkups is like the surgical site infections. I'm sure a lot of you heard about the nosocomial infections. Are you? If you heard about it, like raise your hand so I can understand. Okay, good. So for those who don't understand what is that, nosocomial infections basically the infections that usually arise in the hospitals, where a lot of patients with different diseases, and there is like supposed to be a sterile conditions, but it's not always so. Since these bacteria, these pathogens, they gain the resistance to the antibiotics, and if you gain any sort of infection back in the hospital, it's going to be twice or thrice harder to fight due to the resistance that these bacteria already have. And so basically, yeah, actually, that's the whole presentation itself. And do you have any questions, or it's too fast?
No.
No?
It's perfect. I will be
thank you.
holding.
Okay.
So, okay, good. Please come over here. Give it applause to our first speaker. And now let's have some discussion. Do you have any questions? Are you curious about some things? Or maybe, because she had a lot of useful stuff over here, so you probably have questions, okay?
I have a question regarding the cleaning the mouth and teeth. I've heard that there is a huge information in that using irrigator as a secondary cleaning method, it really helps. Is it really so, or is it just good adverts?
Okay, that's actually a very common question that I get asked. And the thing is that it helps, but it also depends on the space between your teeth. And the other thing is that the mechanism of the irrigator is basically, imagine you have a cup with a coffee, and you're going to clean that. But the thing is, irrigator, what it does, it puts simply the water under a high pressure. And if you put like this cup after the coffee, you may see like the signs of the coffee there on the walls. But after like cleaning it with water, does it go away? The mechanism is simply the same. Obviously, if there is like any plaque or like food stuck, it's going to remove it, but there's still going to be a layer on the teeth that still needs to be additionally brushed and cleaned. So you may use it, but still use your floss and brushes, and I recommend to use soft brushes, since it also depends how these bristles of the brush is going like under your teeth, under your gingiva, and there is also like a certain method how you should clean it correctly in order not to cause any like abrasion of your teeth. So the teeth may become very sensitive. So yeah.
So as you said that this pathogen like affect on the myocardium, but I know like it's gonna be the layer pericardium. How it's actually penetrate the pericardium and go inside to the myocardium, this bacteria.
Okay, so the heart itself is an organ, and every organ has its own blood circulation. I mean, every muscle has its own vessels. So with that, like, I mean, the blood goes through everything, as well as the antibodies and the pathogens, and it penetrates all the layers via the same mechanism. So I think it's quite simple.
Okay, humbling you. Any other questions? Okay.
I have a question. I just don't remember at what age I started to brush my teeth, but what age is recommended for children to start cleaning their teeth with brushes and other tools?
Thank you.
That is also a very good question. Actually, it's better to start brushing the baby's teeth from the moment that they appear. So basically, as the infant is going through the process of the breastfeeding, like there is the like specific time that the teeth are just erupted, they are very susceptible. And the milk itself, so what usually happens, if the baby takes the bottle and like goes to sleep, the bottle remains inside, as well as some sweetie like milk or some, I don't know, any other liquid, and the exposition of that sweet liquid to the tooth surface is crucial since it's going to destroy it. And starting from the appearance of these teeth in the mouth, like it's better to use like a very, very soft brushes that are adapted for the infants. And like, first of all, if the baby is very young, you don't have to use like the tooth like paste. But of course there is the adapted versions, but I wouldn't recommend so. But as the baby grows, you have like, it's your responsibility as a parent to brush his or her teeth. And of course the baby may resist. They usually like fight and like they scream and they cry, but it's just the matter of the habit, because once you like start to do it regularly, the baby is going to adapt to that process and it's going to be better, so it's going to be fun.
I never really heard about the correlation between cavities and cardiovascular diseases. So now I'm wondering if specialists often overlook the tooth problems as a cause of the disease. Yeah, this is my question.
That's a brilliant question, actually. Thank you for asking it. The thing is that according to the protocol that I learned back in Hungary, it was important. Like, we always did the dental checkups, not only before some huge surgeries, but also we did checkups on the pregnant women, on the people in the high group risk, for example, those who have diabetes, or for those who have any metabolic disorders. And the thing is that here in Kazakhstan, to be honest, I cannot say, and I don't think it will be true, because I was working in the private clinics. I cannot speak for the governmental clinics. But the other thing is that I know in private clinics, we usually just take the anamnesis, we do the X-ray, and that's mostly like, sometimes we ask patients like what kind of diseases or disorders you had. But the main problem is that a lot of patients are not aware of the diseases that they have. So even if you ask them and they don't know, that's still a problem. And that goes not only for the metabolic disorders, but for disorders like hepatitis and like HIV, like AIDS. And that's why, like, I don't know how it is going still in Kazakhstan. Like, from my side, I'm doing everything as I was taught back in there. Yet I know there's still a high risk of infection or getting this kind of diseases. So I don't know, it's like very important to go through that, but I'm not really sure if the other doctors here are aware of that too. But maybe with my presentation, it's a little bit clearer. I don't know.
Okay. So thank you so much, Yenlik, for your presentation and speech today. Have a seat, please. Let's move on to our second speaker. Dr. Aslan Temirkhanov. He's NIS 2016 and NUSOM 2025 alumni. When I asked him about his comfort food, he didn't hesitate. He said it's Georgian and Korean cuisine. And also his favorite series is Grey's Anatomy. And not just because it's like dramatic series, but just he says that he has actually grown as a physician while watching it, which I think says a lot about how seriously he takes his profession. So today he will speak on a topic that feels especially relevant in our time: how to recognize reliable medicine in the age of wellness trends. In a world of full of advice, influencers, supplements, and trending, miracle solutions, how do you know who we can trust? Please welcome Dr. Aslan Temirkhanov.
Thank you, everyone. My name is Aslan. I have a clinical experience as a family doctor. I have experience in working in public health sector. I was a former research advisor, a consultant for different UN agencies as WHO, UNFPA, UNESCO, not only in Kazakhstan, Central Asia, and region of the Europe. Also, I did a research during my master's degree at Nazarbayev University School of Medicine. I graduated as a Master of Molecular Medicine, and I have experience in different fields of medicine. Now I work in the pharmaceutical industry. Previously I worked in Pfizer Kazakhstan, now I work in Roche Kazakhstan. I want to say that today I'm not representing any of those companies. I'm presenting on my behalf, so none of this is related to my actual current work. So today's topic that I have chosen, I love talking about evidence-based medicine, talking about research, and today we wanted to talk about how to recognize reliable medicine in the age of wellness trends. So as you can see, here are what we think that those supplements, those cool, fancy, expensive things can give us, but in the reality, most of them, they don't have even evidence. So we have to realize why we have this, let's say, problem, and why we have now wellness trends. Because we have more than ever, we have more health information than any generation in history, and more health anxiety, because we have now more research, more information, and when we have so much information, we don't know how to trust it. That's why many people start believing many nice trends, adverts, for example, detox programs, hormone balancing. Maybe you've heard about adrenal anxiety, усталые надпочечники, something like this, microbiome optimization, functional testing, anti-parasite protocols, integrative medicine supplements, and those, they have one common thing: to earn more money. When they talk about their programs, their products, they say, we want to make you healthier. But in reality, we have to understand it's money, because if you compare the price for the integrative medicine specialist and the regular doctor, it will be very drastic difference. I know that, for example, in Almaty, there is a couple of famous functional integrative medicine specialists. One visit costs 100,000 tenge, 100,000 tenge, which I think it's quite insane. And why it matters? Usually they say, oh, you let's say regular doctors, you blame us for everything, but okay, do your money. It's fine. Sell your supplements. But why we care a lot about this? Why we talk? We try to fight against it? Because in reality, it has consequences that we face later as doctors working in government or even private sector. For example, delayed early diagnosis, unnecessary costs, chronic anxiety, medicalization of normal sensitizations, direct health harm from untested products. As I said, some of the tests and the products don't even have any database or information. In some cases, it can be life-threatening outcomes and deaths, even from some supplements or tests. And there are a lot of if you search in the Instagram or go to the to GIS or some private integrative health medicine clinics, you'll see a lot of people commenting and saying that the clinics, they said they are healthy, but in reality they had real life-threatening diagnosis. I know, for example, there is one clinic, I cannot say the name because I don't have that much money to find the whole jurist department, but there is one clinic that, for example, says to patients with arterial hypertension, diabetes, don't take the medicine. Take our herbal, for example, supplements, body, because it's natural, it helps. And there were real cases when those patients, because they didn't take actual medicine, they had a stroke, they had high levels of the glucose because they listened to them. Because as a patient, as a regular person, we don't know, because they also seem to be a doctor. And biggest argument regarding this wellness trends that, oh, big pharma is trying to earn money, we are trying to help. But if we take a look at the real number, wellness industry earns 4 times more than real pharmaceutical industry, than real drugs and the doctors. And yeah, I agree that this is a whole in wellness industry. It can be sports and everything. But even if we take a look into the subdivisions, the healthy eating and nutrition and the weight loss, all supplements takes 1.96 billion. I think it's a lot of money. So it's a real business and money. And what is evidence-based medicine? Actually, it's best research evidence, it's a clinical expertise, and also patient values all included together. And I didn't want to today overwhelm you with the whole concept of it. We have different types of the trials, but one thing that you have to take into mind, it's randomized controlled trials, clinical trials. Those are this type of the research. We say the golden standard of the evidence-based medicine. Many of the, let's say, regular drugs like paracetamol and everything, they have testing, they have preclinical, clinical, post-clinical, post-marketing research phases of the studies. Most of the supplements, for example, they don't have it. And what is a randomized control trial and why we trust it and why we say that it's a gold standard? Because there, people are randomly divided into 2 groups. It's very basic. I tried to make it easier because I saw that maybe today not many medical people will be. And one group receives the treatment, the other receives placebo. And neither patients, no doctor know who gets which. There is like one double blinding and the other settings, but I didn't go into depth. But that's just a simple concept of this. And you can see that from this, doctor doesn't know, the patient doesn't know, and there are 2 groups, and we can really test the drug works or not. But before, there is a preclinical studies for the safety, and then there is also post-marketing surveillance to see, okay, we test the drug, but maybe it has a long-term side effects in the 5 years, 10 years. So real big companies, they try to investigate those. Many supplemental companies, they don't do it. They just and also you have to keep in mind, many supplementals come into Kazakhstan not as drugs. They come to as a пищевая добавка, as a thing that you add to it's like a food. It's just a food. So one thing, there are a lot of examples of those trends. I've picked up one of the famous ones, so maybe you will spread this information among your peers and friends. For example, can a blood test diagnose dysbiosis? Dysbiosis, это dysbios, or how it was before used to be called dysbacterios. Now we say dysbios, and many those wellness trend physicians, they say we can check it, you have a good bacteria or not, by simply taking your blood. And this is a very famous example of the test. HMS по Осипова, or Osipov GSMS, HMS microbiota test. It has different names, but it's one concept. It's chemically a real kind of a test because it uses mass spectrometer, but we have to understand that gut bacteria live inside the intestine. Their composition changes daily, and we cannot really count. We don't have real consensus in the world of the physicians and researchers how much good bacteria you should have, 10, 1,000, 1 million, and we don't know. But they say they know. They say we can say how many good bacteria you know and what to eat. And the good metabolites are indirect signals. They say that through the blood we can see the composition of the bacteria and through these metabolic signals, and it can be a great picture. Many people, even this method came from the Russian Federation, and even many doctors practicing in Russia, they say we don't use it because it's not really informative. Another thing is antiparasitic treatment, different protocol systems using immunoglobulin G, IgG. You have to understand that the positive IgG doesn't mean active infection. Some of you are medical workers, students, practicing, maybe doctors. You know that this is we call it immune memory. There is different types of the immunoglobulin, immunoglobulin M, G. G means you maybe had once interaction with a parasite, but it doesn't necessarily say you have it right now. And there are, to really find out that you have a parasite inside you, there has to be a lot of things to be done. It's symptoms, clinical context, it's stool microscopy, and maybe you know this Kalnaitsa-Gliss analysis, yes? And even this diagnostic test has to be done many times because there are a lot of concepts. I don't want to go to depths, but it has to be warm stool. It has to be not with the, you have to, I'm sorry for details, but you have to poop into, not like a toilet, but into something dry, so it doesn't contaminate with the water and the other thing, yes? So it's like a lot of things, and it's really hard, but not just IgG and, let's do our antiparasitic treatment. Treating antibiotics is not treating live infection. You have to remember it. Tumor markers, my lovely topic. Many clinics, they give you an analysis for diagnosis. They prescribe you a lot of tumor markers. But we have to understand that tumor markers actually work, but they are not for screening. They are used by oncologists when you have actually oncology diagnosis to see how the treatment is going. It's not like for screening. So tumor markers are used after cancer is diagnosed to see whether treatment is working. They are not reliable for screening of the healthy people. And some of the healthy people without tumors, they might have elevated sometimes those markers. So it doesn't mean you have a tumor. Supplements detox, my lovely topic. Please, that's your liver and kidney. When you spend a lot of money on some cleaning, some detox, and here is your liver also watching you try a detox juice cleaning. We have a liver for detoxification, like from creature, yeah. We don't need special detoxification things. If you have really toxins in your body, you are not walking. You will be in the hospital, and you have to understand it. Sorry, I haven't been speaking English for quite long, so my English might be a bit poor. And also kidneys, they don't have like really detoxificating function, but they have this filtration function, which also like, let's say, part of the system. So you have actual two organs working for you. You don't need something else. If you feel unwell, maybe you have to go to a doctor and see maybe there is a real organic reason. If you have toxins, as I said, you will be laying unconscious in the hospital, not drinking some juice or supplement that will help you. And the real examples when supplements caused real issues. For example, Lori McClintock, wife of the US congressman, died after taking white mulberry leaf supplement marketed for weight and glucose control. And they say that because of that, there was investigation, and that was most probable cause of her death. And we see this kind of a trend a lot when people with influence. It can be influencer or some politician or people around politician, their wives or actual politician. They might be promoting, do this, I'm drinking today this juice, oh, that's cool, it helps. It doesn't mean we have to trust them. They are not doctors. Sometimes we don't even, we cannot trust even doctors. We have to check the doctors itself. Another example is Oli Oxyalite Pro outbreak in US. The weight loss supplement caused cluster acute liver failure cases. 97 illnesses, 47 severe liver injuries, and 2 liver transplant and 3 deaths in previously healthy adults. And we don't know, yeah, maybe they closed, but we have on the market so many new other drugs that might be causing and leading to this. Green tea extract caused a liver transplant case in a 50-year-old man in the US. He wanted to take this as to prevent heart failure and heart-related diseases as like a just prevention case. As a result, liver transplantation. My own father, I have in total 10 years of experience in the healthcare system. I have a scientific degree. I have a clinical experience. I've been working and studying in many countries. But even I cannot persuade my father not to drink any kind of this thing because he also drinks different leaf extracts and everything. It's really hard, I know, but we have to still spread information that it can be really dangerous. Kobayashi red yeast rice, there was a supplement to lower your cholesterol level. As a result, it was in Japan. And we have this saying that, oh, Japanese people take a lot of supplements and they live for like 100 years. It's not necessarily regarding to this. It's not about the supplements, yes? And even in Japan, there are cases when more than 100 people were hospitalized and some even died. And the last one is Steve Beckler, professional baseball player, died after using a supplement, ephedra containing natural weight energy and weight loss supplement. So we cannot even trust even professional sportsmen because they are usually those also advertising, oh, take the supplements, you need the energy, you have to be like energetic. Unfortunately, even they are not reliable sources, and you can see that unfortunately he died after this. What really actually works? Exercising, very simple, very, not maybe cheap, but almost cheaper things. There are a lot of studies showing that exercise really actually help you without any supplements to be in shape and to have a better health. Even there are a lot of studies. There is one researcher in US, Wendy Suzuki. She has a lot of podcasts and everything. She's really nice and cool scientist. She is studying dementia. And she says that there is a lot of studies and all. Actually, there is a lot of studies showing that physical exercise can reduce dementia and help your brain to work better. Hydration, just drink water. It's cheap. You don't need to make your urine or a stool expensive by expensive supplements. Just a regular, adequate hydration is enough. And also, there are a lot of sources proving that. Nutrition, just eat healthy, but there is a difficult also because there are now also hundreds of the nutritionists, with dietitians, and it's really hard to believe who is really actually working with the scientific mindset. The balanced diet is the best. There is no, you have to take into mind, there is no good or bad food. It's just a balance of those products. You can eat a burger, but you have to keep in mind that then, or cake, it's okay, but you have to keep in mind the balance of the proteins, calories, and everything. But if you want to choose a diet, there is scientifically proven that Mediterranean or DASH diet can reduce and can be really helpful. And I'm coming to the end. So how to recognize reliable medicine? It's really hard. Even I, with tons of the years of the experience and degrees, for me, sometimes it's really hard to trust some of the even physicians, my colleagues. But there is one, maybe I tried to make it possible. So proven in randomized control trials and replicate independently. It can be applied for the medication or diagnostic methods, included in clinical guidelines of the highly professional organizations, not some random small association somewhere in the Kazakhstan or US. Clear and specific diagnosis, not toxins, detox on syndromes. It has to be in the world classification of the diseases. No miracle promises. We will treat you 100%. You will be very healthy. No side effects, especially when it comes to natural products. My mom actually says, it's natural. I can take up to 10 pills of the calcium. And I'm like, no, you can't. And she's like, oh, it's natural. It's a Japanese bath. And I'm like, no. Nothing cannot be 100% safe and without side effects. Even water, if you drink a lot of water, too much water, you can die from it. But it's almost impossible. But yeah, recommendations based on clinical studies, not personal experience, no influencers, no cool people with millions of the followers. Please trust only your knowledge, science, and and maybe it will help us to not to die from as some of the people died from those wellness trends. Thank you. That was the end. Yeah, and if you have questions, I might be. Yeah.
So I don't need this one. Yes. So give applause to Aslan. And now questions.
So, what is one of the most biggest or the most scandalous, the most absurd scandals related to the supplements and their ineffectivity on your memory?
From my experience.
Yeah, from your mix.
There was a patient of mine that I sent to oncologist, and I was in contact with this oncologist, and she said that the patient refused to take a chemotherapy because some, let's say, those of the not good doctors said chemo is like killing you. You don't need any chemo or any treatment. Take take this fasting, and when you don't fast, eat fruits, and there are special herb supplements. And the patient did it. We tried to convince, it didn't work out. And in the end, I'm not sure is the person alive or not. We didn't follow up because the patient refused to talking to us later. But I know that it progressed to the first stage of the cancer. It was lung cancer. Yeah, so that was really sad that people actually die from those recommendations.
So my main question is about collagen. Like, I think a lot of girls are taking collagen for the skin and for the nails and for the hair, and there are a lot of collagen, like a very good taste, like cherries, and I mean, it's very tasty. And is it efficient though? Because some of my friends, they told me that it really works, but I'm not sure if it's just the protein balance that is going, like, I don't know, getting. So okay, I cannot finish this question.
Yeah, no, I got it. Thank you. That's a really good question. I actually wanted to put it in the slide, but it would be too much. Collagen actually works because that's the protein. When you eat it, it goes as back to amino acids, and you have better like protein. But it doesn't go directly to your skin. It doesn't make you glow. There is maybe glow because you just eat more protein, but it doesn't necessarily say that Japanese collagen works better because you have a glow. No, if you just eat, for example, холодец or just eat more protein, you maybe also have this glow. So there is a debate even among researchers because it actually works, but it doesn't work as they say, that it goes directly to your skin and you have a glow. Yeah, so.
Any other questions?
Do you have any tips on how to persuade your parents and grandparents to stop taking those food supplements? Because I want them to live a long and happy life, and I don't want their livers to suffer.
I have understood one thing, that I will never persuade my parents regarding medical topic, even if I will be 10 times PhD in healthcare. What I do, I take them to another trusted physician who says and tries to persuade. I understand that we will be still children to our parents, and it's really hard. So when there is another adult with a medical degree that I can trust says the same thing for the money, it works actually. So I had to take my mother to some private clinics, to some of my friends, to pay actual money. So she believes and trusts me. Because they trust us, but it works, I don't know, differently. My father, for example, has a diabetes now, also arterial hypertension. I spent 5 years to persuade him to take pills for hypertension. Now I'm in the process of still for second year to convince him to take metformin for his diabetes. So it's a long way, but we shouldn't stop, because otherwise it will be maybe fatal.
What about national ways of treating for the ill, like koydun maya or some saumal, or this kind of different stuff that we actually ancestors everyone all used it, and still people are using it?
That's a really good question. question. And you know, there is a debate because WHO, if you have noticed, recently started supporting somehow the not conventional medicine. And many people were in science were like, why? Because it's really hard to persuade people who are using this not to use it. At least we can try to make it safer. And at the same time, I'm not saying it's good and you have to use it. Some of those things are actually, they work, but we have to consider they worked in the previous ages. Now we have the same thing, but better. So why not to use something that is tested? I don't think there is a clinical trial on Koidmaya, for example, yes, but there is a clinical trial on some things that can help you to fight the fever. Or for example, suluk, I don't know in English, the кровососущие штучки, пиявки. So they actually work because it's not like they are sucking the blood, but when in their saliva there is a chemical that is making your blood like softer. No. Yeah. But we have the same drugs, but it's tested and we can measure it. So why not to take the actual the pill, which is almost the same, but in the piyavki we cannot measure it. We cannot measure how much it will be, and it's also not many people practicing those. They are using hygiene methods. So I'm for. Some of the things really works, like кровоиспускание, yes. It's sometimes in hematology we still do it, but doing in a clinical setting with a special physician, with real person or someone in the непонятном месте, I don't know. I would choose something which is novel, which is modern, because science doesn't say they don't work. They say we made it better, we made it more tested, we made it something something which is reliable now. Yeah, so thank you. That's a really good question.
Thank you so much, Aslan, for the speech and for the presentation.
Thank you.
Give it a applause. Okay, so the last speaker. Sorry. So our third speaker, Aidana Amangeldiyeva. Please welcome her. She's Nazarbayev University alumni 2016 and also master's degree alumni, right?
Medical, Doctor of Medicine.
Doctor of Medicine from Nazarbayev University, also alumni. And she's currently working in medical affairs at a pharmaceutical company. Little interesting facts about her. Her comfort food is окрошка, apparently, and also her favorite movie is 7 Years in Tibet, story about growth, reflection, and transformation. And today's topic is Inside Pharma, the journey of drug beyond the laboratory, because medicine doesn't end in the lab. That's actually where a whole new journey begins. Please welcome Aidana Amangeldiyeva.
Thank you very much. I was actually offered to speak either in English or Russian, and I chose Russian. So from now on, I will be speaking Russian, if you don't mind. Всем привет. Всем спасибо сегодня, что нашли время поучаствовать в наших дискуссиях. Спасибо, Айжан, за организацию такого классного формата встреч, где мы можем делиться опытом и освещать темы полезные для общества. И я тоже вот относительно сегодняшней темы, да, Health Beyond Medicine, тоже для себя решила, что это такая классная возможность рассказать и про свой опыт, и побольше осветить о деятельности фарминдустрии, потому что, ну, как на мой взгляд, это такая малоосвещенная вообще тема, они не так часто говорят, то есть я не видела таких подкастов или блогеров, которые прям так рассказывают про фарминдустрию. И вот, собственно, пользуясь случаем, и один из таких смешных, наверное, примеров, где я вот видела, что общество не так хорошо, да, понимает, как работает фарминдустрия. Это вот был, короче, такой рилс у Галма Каликпарова, это такой стендап-комик, знаете, такого. Короче, он там на концерте спрашивает у зрительницы, чем она занимается. Она говорит, я работаю в фармкомпании, ну, я специалист по фармаконадзору. И он такой, вы там ходите по аптекам, что-то проверяете. Она говорит, нет, она говорит, после, ну, она там, короче, такая оговорка, кажется, была, она говорит, после того, как препарат уже зарегистрирован, я отслеживаю побочные эффекты. То есть она, ну, не вставила, не успела сказать, что это делается не только после регистрации, ну, как бы, вот так вот, в общем, она ответила, и тут, короче, весь зал взрывается, смеются, ну, как бы, и Галан такой говорит, в смысле вы это делаете после, как бы это не должно до происходить. То есть я уже принимаю там какую-то таблетку, и у меня там что-то чешется, и потом вы такие фиксируете это, она такая, не пойдет, и убираете. И, ну, в общем, это действительно такая, мне кажется, смешная шутка, в которой есть просто такое недопонимание, да, но, с другой стороны, тоже показывает то, как мы зачастую не понимаем, да, как весь этот процесс устроен. Ну, я сама, если честно, не понимала, потому что я в этой индустрии тоже оказалась рандомно, и раньше тоже было такого мнения. Ну, было какое-то вот недоверие к работе фарминдустрии, там мы часто слышим, да, разные мнения на этот счет. Поэтому хотелось бы, как человек, который уже работает в этой индустрии, изнутри знает многие процессы, то есть я работала и в клинических исследованиях, да, то есть с самого начала пути, после того, как вот лекарство выходит за пределы лаборатории, да, что с ним случается, и вплоть до назначения уже препарата врачом пациенту, то есть я наблюдала этот путь, поэтому подумала, что через разбор этого пути могу вам подробнее рассказать, в общем, что происходит inside pharma. И, ну, очень коротко хочу остановиться тоже на теме раннего R&D, да, то есть до того, как препарат изучается на людях, конечно, его сначала надо открыть, найти. Этот процесс называется Drug Discovery Development. Это большая тема отдельная, но как бы вкратце хочется сказать, что это очень такой тернистый, долгий путь, и у каждого препарата, в зависимости от его типа, то есть это может быть и small molecule или там, гормонная терапия, ферменты, биологическая терапия, генная инженерия, да, то есть в зависимости от типа каждый препарат проходит свой огромный длинный путь. Иногда это случайная находка, и потом уже впоследствии уже механизм там, и биологическая мишень, да, исследуется. Но и дальше, в общем, эти молекулы тестируются на животных, на тканях, клетках, что мы называем доклинической стадией исследований. Ну, в общем, весь этот путь у нас требует, конечно, масштабных, колоссальных инвестиций от компаний. И зачастую как бы, это отражается в дальнейшем на его стоимости, да, когда он уже выходит на рынок. Ну, допустим, у нас, в общем, наша молекула прошла весь этот скрининг и там, прошла доклинические исследования, показала классные результаты. В этот момент фармкомпания уже решает тестировать этот препарат на людях. Да? Ну, там, для этого тоже, конечно, готовится пакет документов определенный, куда включаются все данные до клинической стадии. Как бы, вообще изначально эта молекула упаковывается в тот вид, в котором она будет существовать вне лаборатории. Да? Там фармацевтическая формула готовится, потом там, документы по контролю качества, по производству этого препарата. Это все как бы, изучается и готовится, и подается в уже регуляторные органы. То есть здесь речь идет не только о самой фармкомпании, какие еще другие структуры, да, помогают нам обеспечить как бы, доступ препарата к пациенту именно этичным и безопасным путем. У нас есть как бы, регулирующие разные структуры. И мы все знаем, да, о таком органе, например, в Америке, FDA, Food and Drug Administration, там в Европе тоже есть свое агентство EMA, в Казахстане это NCELS, Национальный центр экспертизы лекарственных средств, там и медицинских изделий, по-моему, тоже есть название. Ну, короче, есть такие органы, да, которые именно смотрят, достаточно ли эти данные для того, чтобы мы могли теперь тестировать это лекарство на людях. Также ведь этот проект проходит проверку и ну, там, в последующем одобряется этическими комитетами, тоже там, на уровне государства или локальном, который уже смотрит, насколько этот препарат действительно не нарушает права пациента, то есть смотрит на этическую, да, составляющую. И только после получения одобрения этими органами фармкомпания уже получает зеленый цвет тестировать препарат на людях. И ну, как бы, что мы называем клинической разработкой. И Так, сори, я, кажется, должна была нажать на этот слайд, прежде чем это рассказывать. Здесь вот я говорила про эти этапы. Ну, в общем, у нас клиническая разработка уже проходит в 4 фазах. Да? Мне кажется, это тоже на слуху, все знают, особенно во время там, пандемии, когда вот, говорили активно про исследования вакцин, да? Мы там слышали про эти фазы. Там первая фаза, когда препарат вообще впервые сталкивается с пациентом, с человеком, да, живым. Это, как правило, маленькая группа людей, здоровых волонтеров, которые такие: окей, вы можете на мне протестировать. Да? Здесь определяется там, изначальная там, безопасная доза, какие-то вот профиль безопасности общий. Да? То есть главный вопрос, на который мы отвечаем, это безопасно ли это вообще принять. То есть уже неважно, там, эффект есть, нет. Окей, зафиксировали, безопасно. Идем на следующую фазу. Здесь уже побольше людей у нас. Для того, чтобы выявить вообще препарат как-то работает по назначению, по показанию, да, то есть лечит ли он как-то вот это там заболевание. Здесь побольше людей участвует и, как правило, пациенты уже с заболеванием. Третья фаза. Здесь речь уже идет о большом масштабе. Тут сотни или тысячи пациентов. И это вот самая интересная фаза как раз, потому что, во-первых, она такая очень масштабная. Да? Опять-таки компании инвестируют огромные бюджеты, чтобы провести эту фазу. Это много центров, много стран вообще, много разных там, врачей, разные системы здравоохранения. Они все тестируют по одному вот единому протоколу клиническому, да, этот препарат. Поэтому это вот очень долгий и затратный процесс. Также имеет значение дизайн, да, исследований. В третьей фазе у нас обычно такие сложные дизайны, в которых есть рандомизация, вот, чтобы оно было контролируемым, да, ослепление, заслепление, потом там, такие сложные большие статистические, да, как их называют, независимая статистическая оценка. Вот, это проводят. И, ну, в общем, сам дизайн такой сложный, клинический протокол большой, там очень много разных пунктов, над которыми вот работают тоже специалисты, врачи, биостатистики. Но зато результаты именно этой фазы, третьей, считаются, вот confirmation, да, написано, то, что нам дает впервые какой-то evidence. То есть, когда мы говорим evidence-based medicine, зачастую речь идет именно об этой фазе, то есть о результатах, успешных результатах, пройденных в этой фазе. Конечно, в последующем evidence может быть также генерироваться на других стадиях и опровергаться, но это вот базовый минимум, да, как мы говорим, который нужен, чтобы мы назвали что-то evidence-based. И ради этого, получается, вот, проводится вся эта большая основательная работа, и на основании результатов этой фазы, мы ее часто называем регистрационной, препарат получает свой approval этими органами, опять вот NSAIDs, да, FDA, чтобы уже выйти на рынок. Ну, в последующем также проводятся постмаркетинговые исследования, немаловажные, потому что как бы все-таки в клинических исследованиях мы говорим о 100 тысячах, да, пациентах, а в 4-й фазе речь может идти уже о миллионах. То есть когда препарат уже доступен всему рынку, мы можем увидеть какие-то редкие побочные эффекты, которые мы вначале не увидели. И это очень важно отслеживать. И вот как раз та девушка, которая была на концерте Галлама, она вот, скорее всего, занималась вот этой частью, фармаконадзором в 4-й фазе. И, ну, в случае чего препарат даже могут отозвать. То есть у нас очень много таких историй, как бы в истории фармакологии, фармацевтики, что отзывали препарат, если там выясняли, что там новый какой-то побочный эффект, да, был выявлен после его уже одобрения. Ну, в общем, ну, также, по идее, хотелось бы добавить, что весь этот процесс как бы, клинических исследований, он жестко регламентирован такими вот моментами, как, например, GCP, это вот Good Clinical Practice, называется, это стандарт по надлежащей практике проведения клинических исследований. Там исследования мониторируются такими вот специалистами, вот я вот была таким вот монитором, я изнутри видела, как мы следили за тем, чтобы этот протокол четко соблюдался, все стандарты GCP соблюдались, да, там постоянно проходили аудиты, инспекции, которые могли прийти и проверить, ну, за счет чего мы всегда знаем, что клинические исследования официальные, которые регистрируются, они на самом деле проверяются, и там очень сложно что-то сфальсифицировать или там придумать. Все должно быть очень прозрачно. Ну, допустим, вот все, наш препарат, короче, прошел этот путь весь, он получил свою регистрацию в стране, допустим, в Казахстане. И как вы думаете, сможет ли любой пациент, который, например, болеет этим заболеванием, да, получить этот препарат? Он ведь зарегистрирован в стране, он заказал свою безопасность, эффективность, как бы может применяться. Вот. Да. Да, ну вы правы, потому что помимо регистрации, как бы также у нас что должно произойти, да? У нас должны быть вот дополнительные вещи, да, проделаться. Во-первых, об этом должен знать врач. То есть врачи, особенно если это редкое заболевание и терапия какая-то вот инновационная, врачи могут и не знать, да, о существовании даже самого заболевания, не то что о том, что у него есть какое-то лечение. То есть есть такой разрыв, и поэтому, ну как бы вот первая проблема — это то, что как бы врачи могут об этом не знать. Они должны об этом узнать, иметь соответствующий вот именно уровень осведомленности, экспертизу по применению этого препарата и вообще быть комфортными применять этот препарат. То есть не факт, что даже если он знает, он такой: я буду назначать там какой-то, я не знаю, новый препарат, допустим, я не знаю, там, лорлатинип, я не знаю, в третьей линии или там в первой линии какого-то там рака, да, используется. И что я об этом прочитала, то есть это, конечно, известно, там в PubMed где-то есть исследования, да, я прочитала, думаю, что это reliable, но насколько я могу взять и назначить это своему пациенту? То есть есть какие-то риски, да? Поэтому очень важно, чтобы это было интегрировано в систему здравоохранения. То есть как минимум быть в клиническом протоколе, да, как Аслан тоже нам сказал. Мы смотрим на какие там препараты, да, которые мы оцениваем как evidence-based, те, которые там прошли регистрацию, там имеют клиническую базу, доказательную базу, и также есть в клинических гайдлайнах. Ну вот, в общем, эти две вещи как минимум должны произойти, и здесь, конечно, вот вступают в силу такие вот функции внутри фарминдустрии, как medical affairs. Вот я сейчас работаю там, market access и маркетинг. Medical affairs занимается тем, что вот как раз-таки помогает врачам узнать побольше, и не просто побольше, а вот глубоко понять, что это за препарат. И зачастую бывает вообще узнать, что за нозология, как правильно ее диагностировать, там, путем разных образовательных мероприятий. Там, они получают запросы разные медицинские, как бы работают над ответами и международной командой для того, чтобы полностью дать всю необходимую доказательную базу врачу. Также, ну, как бы medical affairs тоже может заниматься disease awareness, там, среди населения в целом, чтобы вот suspicion rate, да, поднять и правильно там рано продиагностировать заболевание. Далее у нас есть market access. Это вот отдел, который работает над выводом препарата в рынок. То есть регистрация не равно наличию на рынке, да. Они там составляют фармакоэкономический анализ, проводят, там досье составляют и там оценивают, как это влияет на бюджет, сравнивают с уже существующей стандартной терапией. То есть они предоставляют все необходимые данные для государства, чтобы государство могло принять решение, нужно ли мне включать этот препарат в клинический протокол, во-вторых, нужно ли вообще его спонсировать, то есть включить это в систему reimbursement, да, мы говорим, это вот возмещение. И как бы при успешном как бы процессе у нас препарат включается в протокол, возмещается государством, ну это в случае Казахстана, да, по крайней мере, и врачу, конечно, уже намного комфортнее его назначать, если он в него верит. Ну, как бы он думает, что это reliable, там, почитав все данные, да, о нем. И немаловажное дело — это маркетинг, который, ну, во всех как других, да, компаниях занимается тем, что рассказывает о наличии вообще какого-то нового препарата на рынке. Тоже очень важно об этом рассказывать, о его преимуществах, ну, для того, чтобы вот что-то очень важное и ценное где-то там не запылилось, не осталось, потому что часто бывает, что даже зарегистрированный нужный какой-то препарат, он не применяется, потому что на рынке там есть маркетинг и прочих других, да, у нас там всяких и БАДов, и там не работающих на самом деле препаратов, их маркетинг может просто быть более мощным. И здесь, конечно, тоже важно иметь такой отдел, который будет работать над сознанием, над восприятием таких вот препаратов. Ну и в заключение просто хотела бы добавить, что вот фарминдустрия это как бы не заканчивается на создании лекарства и продаже. Между ним есть вот огромный такой путь, который проходит препарат, и это на самом деле большое пространство для медиков, как альтернативный путь карьеры, да, развиваться, также вот делать свой вклад, чтобы препарат получил свое место в реальной практике и чтобы его как бы правильно применяли, знали о нем. Вот. Собственно, над этим я тоже работаю, и надеюсь, было полезно. Так, все.
Okay, good. Do you have any questions? Yes, please.
У меня вопрос касательно стадии фазы номер 3. В самом начале, когда разработка идет, сколько в среднем времени занимает, чтобы лекарство одобрили? И, например, есть ли разница, это какая-то срочная болезнь, например, COVID? Или...
Да, классный вопрос, да, по идее, потому что занимать это может очень много времени, там 10-12 лет, даже больше, 20 лет, может, иногда там 3 года. Я, например, была свидетелем, сама участвовала в исследованиях, которые там длился, там, 1 год длилось, да, исследование, то есть по-разному. Но во время ковида, да, у нас массово же ведь тестировалось, то есть у нас было добровольцев вот этих, да, было очень много. То есть почему поэтапно у нас по фазе у нас проходит исследование? Вначале там вот мы набираем добровольцев, потом более большую выборку, потом нужно еще найти пациентов, которые болеют, а это тоже непростой процесс, да, там есть критерии включения, исключения жесткие. Это все очень сильно растягивает вот этот момент. А во время ковида у нас каждый подходил как участник, да, исследования по критериям включения. У нас там одновременно, то есть не в целях исследования, в целом люди как бы пользовались этой вакциной в качестве уже применения, да, и за счет этого у нас сильно ускорился процесс всех фаз. Вот. Из-за срочности тоже, как бы, тут много было факторов, да. Да. Еще вопросы?
У меня вопрос насчет, есть сейчас такое направление в фарме, как patient advocacy, да. И мне вот интересно, почему его отделили отдельно, он же раньше был частью что-то medical, частью market access, как вы думаете, вот какой плюс это дает, почему, это же особо, может быть, даже невыгодно, да, вкладываться в какие-то проекты, и вот с вашей точки зрения?
Ну да, на самом деле я только что перечислила только те отделы, с которыми я сама имею непосредственно какую-то кросс-функциональную связь. Есть куча других, да, фармкомпаниях, даже вот контроль качества, логистика и так далее, это все не перечисляла. И вот один из них — это patient advocacy. У нас, по крайней мере, в Такеде, где я работаю, они вот вместе идут плюс-минус с market access, вот отдел МАПа называют их. Ну, я думаю, что они отдельно, потому что по функции они очень разные. Медицинский отдел отвечает за медицинскую коммуникацию, она работает именно с врачами, с экспертами, и цель как бы работы медицинского отдела — это просто вот обеспечивать научную базу. А patient advocacy, так же, как и, получается, market access, их работа направлена на том, чтобы голос пациентов был услышан, и им терапия была доступна. То есть уже на уровне каких-то диалогов с госструктурами, да, те же вот, как их называют, там главные, если, например, в какой-то пациентской организации, вот самое главное лицо, допустим, руководитель, да, пациентской организации, он также является такой public figure, да, кого слушают, он там идет, борется, там говорит, и так далее. Получается, вот patient advocacy взаимодействует часто именно с такими организациями, поэтому они вот вместе с market access больше.
А теоретически, например, в случае отзыва препарата на вот этой 4-й фазе постмаркетинг, компания может разориться, если она прям вложила столько в этот новый препарат, и теоретически это будет ее крах, да?
В теории может, блокбастер, да? Сейчас я повторюсь, вдруг было не слышно. В теории, да, конечно, может разориться, смотря какая компания. Но, допустим, если это Pfizer, допустим, у него очень много, да, таких крутых препаратов блокбастерных. Если один не взлетел, то есть другой. Ну, как бы это опять-таки дело каких-то вот инвестиций, рисков, да, которые компания тоже, у них есть свои там экономисты, финансисты, которые это все рассчитывают. Я думаю, что если это какая-то маленькая компания, у которой вот это был самой основной точкой прибыли, если она лишится, ну, отзовется, конечно, она потеряет как бы выгоду очень сильно. Да. Может, еще есть вопросы, да?
У меня вопрос немножко касательно этики. Я просто слышала, что, например, какие-то препараты, например, тот же мизим, был такой controversial вопрос касательно того, что он разрабатывался с помощью РНК свинины. Насколько вот получается вопрос этики в плане приема лекарств касается религии, и насколько мусульмане вообще могут принимать, например, тот же мизим, и может по странам или регионам состав лекарств меняется или метод разработки, но не знаю, я понятно объяснила?
Ну, да, я более-менее поняла. Но эти этические комитеты, они не руководствуются определенной религией, они на это особо не смотрят. Ну, как бы у них свой есть там свод правил и критериев, да, по которым они оценивают, насколько применение препарата этичным. А другой вопрос — это раскрытие информации, то есть любая фармкомпания, ну, как бы любой препарат имеет там листок-вкладыш, да, где есть инструкция, полный состав, обязательно об этом пишется. Поэтому это уже на усмотрение пациента, будет ли он принимать препарат или нет, он должен прочитать, ознакомиться. И ну, в случае, если вот есть какие-то вот религиозные взгляды, которые противоречат, это уже его выбор, да. Этический комитет на это не будет смотреть.
Я вот хотела спросить насчет medical affairs и насчет фармпредставителей, потому что вот, например, ко мне на работу вот приходят люди, которые по образованию зачастую сами как бы медики, они врачи или фармацевты, но когда их спрашиваешь насчет доказательной базы, они ничего не могут ответить насчет своего препарата, и они пытаются просто продать. И как работает вот это то, что врачи там получают проценты за как бы продажу этих препаратов и так далее?
Ну, вообще так не должно быть. Я скажу, что это больше очень часто исключение от правила, которое происходит. По правилам так не должно быть. То есть вообще весь этот процесс, он жестко регламентирован. Да? Ну ладно, когда-то вот в нулевых, я знаю, был такой бешеный, вот, беспредельный, да, маркетинг. Там мы знаем разные случаи тоже. И в Казахстане вот, снимали даже фильмы на Netflix, там сериалы про оксикодин или оксикодон, я не помню. Ну, в общем, про то, как вот фармпредставители агрессивно промотировали и не давали всю полную научную информацию. Да? Так не должно быть. Медицинский отдел не должен иметь таких сотрудников. У нас есть наши полевые сотрудники, называются Medical Science Liaisons, которые имеют как раз-таки очень сильный medical и scientific background. Их цель коммуникации заключается как раз в том, чтобы вся информация была non-biased, прозрачной, научной. Я не могу ответить за все другие фармкомпании и за сотрудников, почему такое происходит, но, к сожалению, это правда. И здесь, конечно, это уже отдельная тема, это уже на совесть и на образование, экспертность врача, то есть он тоже должен уметь принимать решения правильно, и вот, как-то так.
Thank you so much for your speech and presentation. Give it applause, please. So we are all done with the speakers. Today we had wonderful, amazing, different speeches, but one clear message connected at all. Health is not just about treatment. It's about awareness, it's about critical thinking, it's about understanding what's evidence-based and what's simply noise. In the age of wellness trends, social media advice, and endless information, we were reminded that real health goes beyond medicine. It requires responsibility, education, and informed decisions. Thank you to all our speakers for your honesty, your presentation, and your courage to speak in front of us all. We have actually small presents for you, so please come to the stage. Yenlik, Aslan, and Aidana. From behalf of the NU and NIS Foundation, we have presents for you. And let's have a photo of the speakers together. Alumni Talks!